My role today is to talk a little bit about the community engagement and what role did that play in Te Ara Oranga. And so, as Richard and others have said, we go back about 6 years when it was an idea, and there were a number of people who were actually, it came out of the time of the Proceeds for Crime, and the Northern DHB were looking and thinking about a program because the problem was escalating in Taitokoro, as in many other parts of the country. And so back then, when Te Ara Oranga was first starting, one of the first things they thought about was, okay, we better have a community meeting and let people know what we're going to be doing with Te Ara Oranga. And I want to say, one of the wonderful things about Te Ara Oranga, it has been a work in progress. So it has never remained static. If it did, I think it would be a failure because there are many lessons that have been learnt over the years, and it's evolved, and well, from my opinion, it's just got better and better because we've had some key learnings. Anyway, so the first thing was, let's go out and talk to the community. And I think there was some naivety in terms of what does that mean when you say you're going to go out and consult with the community. And I remember the first time I was told, see my cousin, Jewel Retty, she's passed away now, but she came to me and she says, do you think you could help me? We've got to do a couple of hui on engage the community, do some consultation. And I said, what for? And then she told me about it. I said, the kaupapa sounds awesome. I says, but if you're talking about community consultation, I says, first of all, the whānau don't like that word consultation, so lose that word. And I says, and where are you going to do that? And she says, we thought Whangarei maybe, and then maybe one up in the mid-north. I says, well, you better go back and talk to whoever you got to talk to because that won't cut it. I can just see Hokianga screaming. Put Hokianga in the room. They'll say, hey, how come you didn't come to us? The far north are going to jump up and down and say, what, you didn't even come up and see us? Then the kaipara are going to be screaming out saying, you didn't even come over to the kaipara? I says, so you better go back and talk about that because you're going to need a lot more than 2 hui. And so she did, and then she came back to me and she says, I think I need some help. Can you help me with that? And I says, okay, well, here's some key things. When you go out to the community, you've got to be really genuine about asking them what they want. Otherwise, don't even bother to ask them because that will upset them. If you ask them what they want, they tell you and you do something different, what you intended to do all the way along. I said, so those are the first things you've got to get right. If you are serious about asking the community, you must be prepared to follow through with what they what they give you. And she said, that's going to be very difficult. I says, well, that's what community kōrero is really about. So anyway, I ended up helping my cousin Jewel, and we went out on the road, and as expected, there were, it wasn't easy. There were some saying, who are you with? The DHB. Oh, well, we're not happy with this and we're not happy with that. And I had to say to them, that may be the case, but what we're going out about is something that matters to all of us. And we really want to hear what you've got to say. And so, the far north had a lot to say. And it wasn't all nice, by the way. But nevertheless, we took that on board, and then, we moved over to the kaipara. And the thing about the community engagement is you can't presume that you know best, because it's community that know community best. So we went to ones in the community and we says, how would you like this to be? We want to come over and have a hui. We want to ask what matters. Meth is a big issue for all of us. Where would you like to have that? How would you like to have that run? Who do you think should lead out on that? So all of those things. Do you want a kai? How should that be done? All of those things we asked them, right? And they said, yep, we think it should be done like this. So it was different for everywhere we went. It was different. How do you want us to pānui this? Do you want to put this out? So that was all of the background work that had to go into that. I want to acknowledge Liz. She's going to talk soon. But Liz was right alongside supporting that. So we did that, and the things that came back were really interesting. There were things like, well, we want a bit of research on this, you know. Is there going to be an evaluation? Is there going to be research? The police, so it was really good what Shane said, because Shane said, you know, in this role, he's had a shift in the way he thinks about things and the importance of prevention and working in a different way. And that's one of the things that came out from Whānau, is that, gee, it'd be good if we could have some police who were basically more empathetic to the whānau and just not straight out arrest. Could you not listen to the story? Because not everyone's a bad person. There are circumstances surrounding it. So that was one of the things that came through. And another thing was like, why can't we have, they didn't use the word lived experience, but they said, why can't we have people who have been there, done that, who know what they're talking about and come and talk to the whānau? So, you know, they were talking about lived experience, that they wanted more lived experience roles. And okay, we took that on board. And then they also talked about, we asked them what things are going to be useful. And they says, well, we'd like to hear messages, not just from the clinicians, the experts. We want to hear from everyday people. We want messages coming out from people in our community, faces we know. So that was another thing that they said. You know, if there's positive messages, we want to recognise those faces who are giving the messages out. We also asked them about what other things are going to be helpful. Well, they said fridge magnets was something they wanted, and banners, you know, banners with messages on them. They wanted good information, you know, good basic information about what is this thing called meth and what does it do to whānau? What do you look out for, right? They also did want to hear from experts like the doctors and that as well. They wanted messages from them. They wanted a waiata. I don't know if Liz is going to play it later, but they wanted waiata and that. So it was very interesting, you know, if you went right through Tai Tokerau, we were getting lots and lots of feedback, positive and not so positive. But once people got past the barriers, they were really open about what they thought could work in their community. And with that information, then started the whole communicating back to the people, because you can't just go out and then say, oh, thank you, that's very nice, and then away you go. You must then go back to the people and you must check in with them. So I had to say to Jewel, Jewel, you've got to do all those hui again, and you've got to go back to them and say, did we get it right? This is what we've developed. Have we got it right? What do you think? Right? And then I said, and be prepared to change if we haven't got it right. So we did that. We went back to all of those communities, and we had a process where we gifted over in the kete, you know, because those were their ideas. And all we'd done is put them together and put them back in the kete. So we went back to those different areas, whether it was at the marae or at the community hall, wherever, and we filled the kete with the resources, and we took them back to the people and asked for their feedback. So it was a nice process, which took a while because, you know, on one end we've got the team ready to go, but you have to wait. You have to be patient in these things, because if you can't bring the community on board, you're not off to a good start. It's going to take much longer for that. And there's that lack of ownership and that. So, yeah, and then came the next part, where then you have to have a full-on communications to feed that back, because we went back to the people who were involved, right? But not everybody was at those hui. So what about those who haven't heard the messages, eh? You know, and so that's where your comms comes in. And that's where Liz and the team were so brilliant. And we went out again and again, giving the messages through the airways, all sorts of ways, putting that back, those messages that we'd received from the community. So that was a piece of work that was done, and it did take a while, but we then did a bit of a launch, and it was so big we had to have it at the movie theatre. That was the biggest place in Whangarei with enough seats, you know. We had it at the movie theatre, and while we had all these components of Te Ara Oranga, I would say perhaps that was one of the most powerful was the comms, is that what had been done in the community. And it was amazing because we had so many lived experienced people there. You know, there was spontaneous haka going on and that. And the energy was beautiful because I think it was an example of how powerful community engagement can be if you take the time to do that well. So having done that, well, then it moved on to, you know, all the next stages. And you're going to hear about all the different components that bring it together. We've heard from Shane talking about how the police are a key part of that. But today you'll hear a little bit about, you know, all these different parts of it. And you will hear a couple of the stories from those who have been very key in terms of, you know, their lives have been impacted around methamphetamine and they've made that huge change in that. So it's just my kōrero is just a brief one, but I just wanted to share the importance of community engagement. It can't be just a provider picks it up and away you go. It doesn't work like that. It requires involvement, you know, from everyone. And I think that's one of the things that we're doing as we go. Over the 6 years, we've continued to involve community in this, learned a lot of lessons along the way, but you'll probably hear that with the talks today. So, yeah, just briefly, I want to acknowledge everybody from being here today, those who are coming to listen, and all of those who have been involved in the journey along the way. I've got a little bit of a different hat because I'm working with one of the NGOs, Ngāti Hine Health Trust, and this is representing us today, and we'll share her story about the Whānau Connector role and what she does in that space. And I think you'll hear from all of those who have those roles, and I think they're important roles to have because they're the ones who can make the inroads where others normally can't. And I want to acknowledge Josie. It's good to have you here, Josie, because you're a whānau member. You're someone who's been directly impacted as the result of, you know, someone's actions in your own whānau. And I think the whānau are a very, very important part of all of this. That's why I just want to acknowledge Josie I invited her to come along today so that she could kind of see what Mahi and Nissa is involved in. But the whānau voice is very important. So I just want to finish on that note and mihi to everybody. Nō reira, tēnā rā tātou katoa.